I think as a medical student, you don't really know what you're getting yourself into. When I came here, definitely realized this is going to be a place that I'm going to learn a lot.
My expectations when picking a residency program is I wanted one that had a really good national reputation. I also wanted one that had a pretty diverse patient base because I wanted to see a good variety of different conditions and disease processes.
So what made me choose Nationwide Children's Hospital over some of the other pediatric programs that I looked at was one of the biggest things was just really how wonderful of a community of physicians and staff that Nationwide Children's Hospital has.
There's a very large number of faculty here that have trained in a med-peds training and are continuing to practice that way, and it gives me the opportunity to see what they've done with the training I'm receiving.
You know, you learn about things in medical school and you're like, yeah, but that's so rare, when am I going to see that? And since we have so many specialists here, I've seen things that I didn't think that I would ever actually get to experience. You have your hospital clinic where you see the hospital population and you get to follow those people as a continuity clinic. And then we also get to go to a private community physician. So we go to a pediatrician who's practicing privately, and we call it PECS.
The director of residency program, Dr. Mann, had told me specifically that I would be able to pursue the dreams that I had at this program versus the other programs because I'd come in with an interest of international medicine and also in oncology. I actually got to go in my second year to Bangladesh and actually work overseas in a jungle hospital, so it was great to be able to have that experience here. And I will tell you that not every program will allow you to do that.
I got to actually go to Malawi for a month, and then they found me a grant through Nationwide Children's Hospital that actually paid for the experience.
I was able to find research, find people that were willing to work with me to do some research and get publications from that.
Nationwide Children's Hospital here is really helping to prepare me to be an excellent primary care pediatrician, as well as by seeing a lot of very rare conditions.
I feel prepared to go either into primary care or to further go on and do a specialty.
Being able to interact with nationally renowned faculty members and being able to do multiple different types of rotations during your residency, so you kind of get a glimpse of each type of department of pediatrics.
By bringing in more patients, you're going to have so many more opportunities to see new disease processes.
I think it's great that our patient rooms are larger because really it's easier to take care of patients who are happier, patients who feel comfortable, patients who feel safe.
Encouraging the psychosocial aspect of a child's well-being, and I think that's huge.
If you want a Master of Pediatrics and you want to have a lot of fun getting it, choose Nationwide Children's Hospital.